I chose to become a pharmacist because I had an interest in science and medicine, and it combined everything that I wanted to do. And I also talked to people who were pharmacists who were satisfied with their profession. One of the stories happened as I was working in a chain pharmacy. Was ringing up a patient at the register and asking her how things were going. And she told me that she had been very tired, so tired she couldn't function, she couldn't do anything. And I looked at the medication that we were, that she was picking up, and I saw that it was metoprolol. And so I asked her, what time of day do you take this medication? And she said, I take it in the morning. So I suggested that she take it in the evening. So a couple weeks later she came back and she said, that was life-changing. Thank you so much. Because why didn't my doctor tell me that? You know, it was just so simple. And she said that she could function, her life was normal, and she was happy. At another time, I was working at a physician's office seeing patients, and a patient came in with her daughter. As she walked in the door, the patient kind of like, you know, was dizzy, and I said, boy, are you dizzy? And she said, oh yeah, I am all the time. And so she sat down and I looked at the chart from her visit that day, and I noticed her blood pressure was low, and I asked about that, and they said, well, nobody was concerned about it. And then we started going through her meds, and when we got all the way to the end, they said, well, what about this other medication? And it turns out that her doctor had stopped her taking one of her high blood pressure medications, and she was still taking it, and he had given her a new one. So she was taking too many blood pressure medicines. Her blood pressure was too low. She was dizzy because of that, and a fall risk. And her physician was just shocked when I told him, because somehow the communication wasn't there where it was with me as a pharmacist. I was doing a complete med review for a patient, Medicare Part D patient. He was an asthmatic person, and he also he used a breathing machine at night to help. He has CPAP, and when I went through his meds, for number one, he had no rescue inhaler, and number two, he was using neosynephrine at night to open up his nose. He said he had to have it to open his nose so he could use the machine. Well, you're not supposed to use that more than 3 days, and so it was probably causing rebound. So I called up his allergist who was really managing his asthma, and the allergist was surprised that he didn't have a rescue inhaler, and especially this gentleman was going to start exercising more, and so we got a prescription for that, and then also we came up with a plan to manage so the patient could go off the neosynephrine and have a plan that made more sense, and that he was happy with that, and the physician was too. Pharmacists should be recognized as providers because there's a gap in care for patients that is missing right now. For example, for my example, I found out a medication that a patient was on that the doctor thought she had discontinued. There's just so many situations like that I've seen where there are gaps, and the pharmacist can fill that gap, but if we're not being reimbursed for our services, then we're not going to be there to fill it.